Welcome to our YouTube channel. Today we are going to talk about 15 early warning signs of heart disease you should look out for. Your heart, a vital organ that tirelessly keeps you going, deserves your attention and care. In this insightful video, we'll be shedding light on the subtle signals that your body might be sending you, indicating potential heart health issues. Knowledge is the first step towards prevention, so join us as we uncover these crucial indicators and empower ourselves with the understanding needed to prioritize our cardiovascular well-being. Let's jump in and explore the early warnings that could make all the difference. But before moving further, tell us, are you liking the video? If yes, kindly subscribe to our channel for more intriguing videos. Number 15. Chest discomfort. This is one of the most common signs. It can manifest as pressure, tightness, pain, or a squeezing sensation in the chest. It might come and go or last for several minutes. Angina. This is often described as a feeling of pressure, heaviness, tightness, or squeezing in the chest. It can also be accompanied by pain in the arms, neck, jaw, shoulder, or back. Angina is usually triggered by physical exertion or stress and tends to go away with rest. Number 14. Shortness of breath. Feeling breathless, even after mild exertion or while at rest, can be an indicator of heart issues. Shortness of breath can indeed be a symptom of heart disease, particularly when it's related to a condition called heart failure. Heart failure occurs when the heart's ability to pump blood is compromised, leading to a buildup of fluid in the lungs and other parts of the body. This can result in difficulty breathing, especially during physical activity or when lying down. Number 13. Fatigue. Unexplained fatigue or weakness could be a sign that your heart is struggling to pump blood effectively. Coronary artery disease. This is the most common type of heart disease and is caused by a buildup of plaque in the coronary arteries, which supply blood to the heart muscle. Reduced blood flow to the heart can lead to symptoms like chest pain and fatigue. Number 12. Rapid or irregular heartbeat. Palpitations, a sensation of your heart racing or fluttering, could indicate an issue with your heart's rhythm. Rapid or irregular heartbeat can be a symptom of various heart-related conditions, and they might indicate an underlying heart disease or a related issue. One common term used to describe this condition is arrhythmia. Arrhythmias are abnormalities in the rhythm of the heart's electrical system, which controls the heartbeat. Number 11. Swelling. Fluid retention can lead to swelling in your feet, ankles, legs, or even your abdomen. Number 10. Pain in other parts of the body. Pain or discomfort in the neck, jaw, shoulder, back, or arm, especially on the left side, could be a sign of heart problems. Sometimes, heart-related pain can radiate from the chest to these areas. This is often seen in cases of angina or a heart attack. The pain might feel like a dull ache, pressure, or squeezing sensation. Number 9. Nausea or indigestion. Nausea and indigestion can indeed be symptoms of heart disease, specifically when they are accompanied by other cardiovascular symptoms. Nausea, indigestion, and even vomiting can sometimes be associated with angina, which is chest pain or discomfort caused by reduced blood flow to the heart muscle. Severe nausea, vomiting, and indigestion can also occur during a heart attack, along with other classic symptoms such as chest pain or pressure, shortness of breath, and pain radiating down the arm, neck, jaw, or back. Number 8. Sweating. Sweating can be a symptom of angina, especially during physical exertion or emotional stress. Irregular heart rhythms can cause the heart to pump less efficiently. This might result in symptoms such as dizziness, fainting, and sweating. Peripheral artery disease is a condition in which the arteries that supply blood to the limbs become narrow or blocked. While not directly related to heart disease, anxiety and stress can lead to increased heart rate and sweating. In some cases, people with heart disease may experience anxiety due to their condition, which can exacerbate these symptoms. Number 7. Snoring. Snoring itself is not a heart disease, but it can sometimes be a symptom or an indicator of an underlying health issue, including conditions that might impact the cardiovascular system. Chronic snoring, especially when accompanied by other symptoms like daytime fatigue, difficulty concentrating, and morning headaches, could be a sign of sleep apnea. Snoring and sleep apnea can cause repeated episodes of oxygen deprivation and sleep fragmentation. These disruptions can lead to chronic inflammation, which is a factor associated with the development of cardiovascular disease. Number 6. High blood pressure. High blood pressure can damage the arteries over time, making them less flexible and more susceptible to atherosclerosis, which is the buildup of fatty deposits called plaques on the artery walls. These plaques can narrow the arteries and restrict blood flow. If a plaque ruptures, it can lead to the formation of blood clots that can block blood flow to the heart. Over time, this can weaken the heart muscle and lead to heart failure, a condition where the heart cannot pump blood effectively to meet the body's needs. If high blood pressure affects the arteries that supply blood to the brain, it can increase the risk of a stroke. A stroke occurs when blood flow to a part of the brain is blocked or when a blood vessel in the brain ruptures. Number 5. High cholesterol. Elevated cholesterol levels can contribute to the development of heart disease and might not cause noticeable symptoms on their own. High cholesterol is often considered a risk factor for heart disease, but it's important to understand the relationship between the two. Cholesterol is a fatty substance that your body needs to build cell membranes, produce hormones, and perform other essential functions. It is transported in the blood by lipoproteins. Foods high in saturated and trans fats can increase LDL cholesterol levels. Lack of exercise can lead to weight gain and unfavorable changes in cholesterol levels. Some individuals are genetically predisposed to having high cholesterol levels. Number 4. Family history. A family history of heart disease can play a significant role in assessing an individual's risk of cardiovascular issues. If you have a family history of heart disease, it means that close relatives, such as parents or siblings, have had heart-related problems. Certain genetic traits can increase your susceptibility to heart disease. These traits can be inherited from your parents, and if your family has a history of heart disease, it may suggest a genetic predisposition. These risk factors include poor dietary habits, lack of exercise, smoking, and stress. If family members have unhealthy habits, regular physical activity, a balanced diet, avoiding tobacco products, managing stress, and maintaining a healthy weight can help mitigate the impact of genetic predisposition. Number 3. Poor appetite. A loss of appetite or feeling of fullness could be related to heart failure. A poor appetite, also known as decreased appetite or loss of appetite, refers to a reduced desire to eat. It can have various causes, ranging from minor issues to more serious medical conditions. If you or someone you know is experiencing a persistent or severe loss of appetite, it's important to consult a medical professional for proper evaluation and guidance. Illness or infection. Number 2. Sleep disturbances. Sudden awakenings due to shortness of breath or a feeling of choking might be related to heart issues, such as sleep apnea or heart failure. Sleep disturbances can indeed be associated with heart disease symptoms. There is a bidirectional relationship between sleep and cardiovascular health, meaning that poor sleep can contribute to heart issues, and existing heart conditions can disrupt sleep. Sleep apnea is a condition where a person's breathing is repeatedly interrupted during sleep. It's a common sleep disorder that has a significant impact on cardiovascular health. Number 1. Cyanosis. Cyanosis is not a heart disease in itself, but rather a symptom that can be associated with certain heart conditions. Cyanosis refers to a bluish or purplish discoloration of the skin, lips, and mucous membranes due to a decrease in the oxygen saturation of the blood. It occurs when the concentration of oxygen in the blood is lower than normal, leading to a higher proportion of deoxygenated hemoglobin. Cyanosis can be caused by various underlying medical conditions, and some of them are related to heart diseases. Certain congenital heart defects can result in the mixing of oxygenated and deoxygenated blood within the heart, leading to cyanosis. We would like to take a moment here and appreciate you all for commenting and sharing your opinions. Your insights always impress us. Do you want to watch more videos like this one? If yes, please like and share the video and subscribe to get exclusive videos about fitness.